Pharmacy manager Kurt Schiffler says there is an easy way to keep track of your medications.
Medication therapy management is where a pharmacist sits down with a customer and they do a full review of all their medications. Not only do they do that, they do a full workup as though they would be with a doctor.
Pharmacy manager Steve Sko says who is eligible for MTM.
MTM specifically as a formalized program would be for Medicare Part D patients with plans that specifically have a segment that allows for payment for MTM.
In the past, it was something that was just between the pharmacist and the patient.
Now it's between the insurance companies, the pharmacist, and the patient.
Sko says MTM has benefits for patients.
Anytime you sit down with a patient and have a one-to-one conversation, it inevitably turns out to be positive. And we help them take their medication in a more thoughtful and more effective manner.
However, there is a negative side as well.
For example, Medica has a mail order or a telephone system where they'll call people to do the MTM over the phone. So we've left messages for somebody to set up an MTM. Meanwhile, Medica has already done that over the phone, and they're the insurance company that would be paying us to do it. So in essence, we're in competition with them.
Multiple pharmacies are alerted to the MTM status of patients, which sets up a competition between pharmacies.
We have customers that we fill all of their prescriptions for except maybe one or two. So if they happen to go to a different pharmacy in the middle of the night, that pharmacy has equal access to their MTM.
In order to stay competitive in today's market, pharmacies need to add more value than just counting and pouring pills. Medication therapy management is just one of the clinical services that needs to be offered to those in need. In St. Joseph, Minnesota, Laura Hinson with UTVS News.